Good evening from Rocky Mountain PBS. I'm Cynthia Hessen. This is Colorado State of Mind. Tonight, the public health dilemma about a familiar chronic disease and one sure path for developing it. The disease is diabetes and the pathway is obesity, and we have a well-qualified panel here to talk more about it tonight. But let's begin with some eye-opening numbers. This week, the iNews team rolled out their latest project, looking at available data and compiling information from several sources. Included in their story are some projections that are made in a report by the Institute for Alternative Futures. They say based on the current rate at which people in Colorado are contracting diabetes, the report takes that trajectory to 2025, less than 15 years from now. And by then, the report says, there could be about 596,000 cases statewide, a number which is more than the population of the city of Denver. The number of those people with visual impairment would be something like the whole population of Loveland, close to 75,000. And here's a bottom line for you. The cost to the state for the care of diabetes patients, $6 billion by 2025, and that amount exceeds what the state of Colorado spends on all Medicaid patients right now. As the iNews story makes clear, the face of that future is seen now in the children and teens who are grappling with obesity. As many as 30% of them could develop diabetes, and for some, the adult onset disease has come before they are adults. iNews' Joe Mahoney has a video set up for us tonight, which he did with Charlie Brennan and Laura Frank. It features one of those teen faces, Raquel Via, and her doctor, Philip Zeitler.
When I was diagnosed with diabetes, I was diagnosed in 7th grade, and I really didn't know what it was at first. I guess you could say that I didn't know how to handle it. They diagnosed me because, like, they asked me what was going on, and I was like, well, I'm really thirsty, and I don't know, a lot to think about.
I'm still very concerned, and maybe more towards the alarming end of the spectrum, in the sense that this is a problem we've not dealt with before. We've dealt with adults with this issue for years. Something about our society and our culture has allowed us to develop this group of children who are not physically active and who are overweight, you know, and to such an extent that they're already getting a disease that used to take 20 or 30 years later to develop.
I definitely have the knowledge on how to be healthy, how to eat healthy. I just like every other person, don't think about it and just do it. But pretty soon here that's changing.
And currently, good data suggests that the number of kids being diagnosed with type 2 diabetes in the United States every year is less than 4,000. So this is not, it remains a rare disorder. Now that's 4,000 times what we used to see in the 70s and 80s, so it's a remarkable change and an important public health factor.
My doctors have told me that it's reversible. It's mainly just diet and exercise. I know that if I got down to a certain weight, my diabetes, I wouldn't say vanish, but or go away, but I wouldn't need to take care of it.
The real message here is don't get to this point, because it's very difficult to reverse weight gain. And I think the message, the broader message, is that we need to be looking at toddlers and preschool kids to look at the trajectory that they're on and to try to change that trajectory so that they don't end up sort of in Raquel's place in the, to start with.
Use the pedals.
Let's talk further about this now with our panel of doctors and a health journalist. Dr. James Hill is Executive Director of the Anschutz Health and Wellness Center, where he directs obesity research and heads the Center for Human Nutrition. In Greeley, Dr. Mark Wallace heads up the Weld County Public Health Department and is a practicing family physician. Also with us, Dr. Michael McDermott, an endocrinologist who is president of the American Diabetes Association Colorado Leadership Board. And Katie McCrimmon, reporter for Health Policy Solutions, who is with us frequently, and she's been tracking the obesity trend and wrote recently about how a whole town is tackling that trend. We'll come back to that. Dr. Wallace, I'm going to start with those numbers that I opened up with, which were pretty eye-opening, and that's just one estimate. Colorado Health Institute, I believe, says 1 in 8 Coloradans may have this disease soon. You say 1 in 4 by the year 2030. That's a lot of people.
Cynthia, it is a lot of people. We don't know exactly where we're going to end up, but what we know is that we're in a phase that we consider an epidemic in the United States today. What we have is already 2/3 of adults either overweight or obese, and we're seeing trends in children that lead us to make estimates that could be as high as up to 50% of adults when they become adults having chronic disease and diabetes that will be affecting them and their work and the community they live in. So I think a conservative estimate of 25% lays out a challenge for us as communities, and that's why we use that number. It's also why we focused on it in a way in our community to say, well, let's get going. Let's not sit back and watch anymore. Let's respond to it. Let's set a goal, and let's go ahead and take that number and use it as the challenge and get moving.
It sounds like one for sure. The other number, Dr. McDermott, that is pretty disturbing is the number of children who are getting type 2 diabetes early, long before you would have expected them to.
Yeah, diabetes in the past, at least type 2 diabetes, has always been considered a disease of adults. We really didn't see it much before age 40 in years past. Now we are seeing it in people in their 20s and 30s and over the past decade, and teenagers as well. I think it's a very worrisome trend. We have projections on what this disease will do to those people and to healthcare costs based on when the disease develops in adults. We don't really even understand yet what impact it's going to have if this large number of children start developing diabetes this early. If 1 out of 4 or even possibly 1 out of 2, we have a very major problem on our hands. Not just public health, but financial as well.
Let me ask you as a follow-up, is there a difference in the way you treat children and adults who have this disease?
Well, the cornerstone of treating diabetes is diet, exercise, and weight loss. Easier said than done. I can tell people that, and it's very difficult. And Dr. Hill is a world expert in all of those. And you know, we know that not everybody can succeed with that. We do have a large number of medications that are very effective that are proven in adults to be safe and effective, but we're not comfortable yet using those in children. And so we really, and because children I think are more able to exercise and I think at their age are more able to get onto a dietary program that's effective, I still think we should concentrate on that, but we do have a number of medications that are effective in adults.
Well, let's turn to our world expert, Jim Hill from Anschutz Health and Wellness Center. I understand that your facility out there at Anschutz is kind of a laboratory in every way. I mean, when you walk into it, you confront stairs rather than an elevator, for instance. Is that right?
That's right. So our challenge is to really try to do something about it, to come up with solutions. And those are science-based solutions. So at the Anschutz Health and Wellness Center, we're both developing the science, how to help people lose weight, how to help people keep weight off, how to help people prevent weight gain in the first place. Then to take the science and create clinical programs in our center to do that. So we have weight management programs, diabetes prevention programs, and ultimately to take it out into the communities. And it's really going to be the communities where we have the ability to reach large number of people. We don't yet know how to solve this problem. We still need lots of good thinking, lots of good research. There's lots we can do today, but we have to continue to come up with creative ways of thinking.
We have seen on this program, and I know the Health Policy Solutions has this map on the front page of your page on the web where it's from the Centers for Disease Control. It shows how the number of obese people and overweight people has increased over 20 years. it's a remarkable animated graphic. And here we have in Colorado the plains, where that is really the story out there on the plains of Colorado.
Yes, it's really ground zero. I think in Colorado we thought, oh, we're fine. We're the leanest state in the nation. This isn't our problem. This is Mississippi's problem, right? And in fact, it's shocking. Our obesity rates, you all well know this, in 1995, our current rates, we would be fatter than Mississippi now. So just in that short period of time. And indeed, the plains are the area in Colorado where we see the highest number. So I went out to Los Animas and saw this problem on the ground, and there's a strong link with poverty. This is also one of the poorest areas in the state.
So that's why I was just going to say, why is that true? Why have we accelerated so much in the number of obesity cases?
You know, just one point to add to that is, even though we're the leanest in adults, we aren't in kids. We're like 25 or 26. So it doesn't take a really smart person to know that we aren't going to be #1 in adults very long with this sort of obesity rates. The problem is it's so complex. We would love it to be about one thing. We would love it to be about eating too much of this or that. The problem is it's about the way we live our lives. Obesity is an unintended consequence of having plenty of food available and not having to exercise very much.
So it's not like the hunter-gatherer days when you expended the energy to go get that
unfortunately,
food.
we still have that biology around, but we are in an environment in which we have plenty, more than plenty. And it is not evenly affecting our population. And so while we don't fully understand all of it, it is something that I think as we move out into our communities, as we look at the kind of programming that we learn from the science, that we go out and we have to be very much in touch that it doesn't impact all of our communities well. When we look at those living in poverty, they are much more affected by this. And so when we start talking about acting as communities, we want to be certain that from a public health perspective, we're aware that there are certain places we need to be certain we don't miss.
And the mechanism of that is that in poverty you are not buying the kinds of healthy foods that would be the better diet?
It's a combination of things, and what we know is it's this balance between what we take in and what we expend. What we find in poverty areas is that access to healthier foods that would not put on as much weight, that are more useful calories, are harder to get. And we also sometimes see that the environment where it's easy to be out and be active and feel safe about doing that and have it be close are also an issue. So it's a very complex situation about how it plays out in our communities, from access to healthy foods, access to healthy living.
Dr. McDermott, would you say that physical exercise that is mandatory in schools has been cut back so much that that has some culpability?
I think it's dramatically cut back. You know, physical activity really needs to be voluntary. Most of us don't have any requirement to be very physically active. We're not requiring it of school children anymore. People who live in the mountains, I mean, it's an interesting thing that you said that people on the plains maybe are heavier. People who live in the mountains tend to be people who enjoy, I think, exercise more, and they tend to participate more in that. And so I think that, like Dr. Zeitler said a few moments ago, we need to have children learning that physical activity is important at the get-go and not wait until they're 20 and say, well, now you are overweight, you need to start being physical activity. This should be something that's entrained from the time you're very small.
I've seen such a clash of cultures too. Let me give you an example from Los Animas, where Live Well is working so hard to try to create change in this community from
Just parenthetically, what's Live Well?
Oh, Live Well Colorado is, well, I should have Dr. Hill explain this, but a group that's working throughout the state. It's a consortium of multiple...
It's a nonprofit devoted to reducing obesity in Colorado.
And several of the largest health groups are involved in this, so it's a group effort. Anyway, their idea is be on the ground in communities and have the change bubble up in communities. And so they're working to make it easier for kids to walk to school, to have a greenhouse and a community garden and nutrition and health classes in schools and that sort of thing. But the director there is also a bus driver, and she was telling me that she drives the kids to their athletic events. And afterwards, this is an area that's very rural, there's this great pressure. Here you've played basketball and you've had this wonderful physical activity. What's the first stop? Fast food restaurant. And they give deals, right? The coaches get a free meal. The kids load up on the giant sodas and the unhealthy food, and so we have the clash. We're attempting to change our culture, but the food culture and the soda culture is so powerful.
A lot of hospitals still have McDonald's in them, I think.
Yes.
But I think it is important to look at this balance between food and physical activity. And one of the things that hurts us out there is trying to focus on one or the other. If you ask the question, is obesity due to eating too much or too little exercise, you've missed the boat by even asking that question. The answer is yes. And it's very important. If we're going to be a sedentary society, there's no diet we can eat to make us healthy. We have to increase activity. The other thing we're focusing on is teaching kids those skills. So I would like that kid on the bus to know that if I want to supersize those French fries, I have to walk 8,000 steps to burn it off. Now, you may choose to do it, but you do it knowing the consequences. We don't teach people how energy and food relates to energy and physical activity. So that's one thing we can begin doing with their kids, giving them the skills to make their own decisions.
And surround them, I think, by everybody knowing this. I think when we're successful in responding to these kinds of things, we have a tremendous commitment to our future generations and to our children. It's something that we rally around in lots of different ways. But one thing that we know is that kids look for role models. They look around them, and they need to be surrounded by this information, not only for themselves, but for their parents, for the adults in their lives, for the teachers that they have in the classroom, for the places where their parents may work. So that what we want to be sure we're doing is saturating our communities with this kind of information so that it becomes part of what is normal to us and what we are all working together to get to, because it is so complex that it will take all of us acting together.
I think it has to be fun also. Exercise kind of have this connotation that you're going to put on some clothes and go to a gym and sweat and not be very comfortable. I probably didn't exercise when I was a kid. I was active for probably 8 hours a day, riding bikes, playing games. And so physical activity is a better word than exercise, and I think we really need to emphasize, and find ways to make physical activity fun and appealing to children and to adults. It needs to be fun. Lifting weights or running 5 miles may not be everybody's, idea of a good time. But we need to be creative and find ways to make that appealing.
And getting the whole family
involved
family, is really key. I've struggled to find areas of success because this is such a bleak story. I don't think people realize, and obesity is the new tobacco. More people are going to die young because of obesity and being overweight than cigarettes, and we need to harness that same kind of energy to go after this. But I did find a program through Rocky Mountain Youth Clinics where they bring the whole family in, so they don't stigmatize children and make them feel like they're doing something wrong, and they help educate parents. And interviewed a mom who worked at Chipotle, and I think time is a big factor. And these are Latino families. The rates are as much as 3 times higher among children. I don't need to tell you that, but it's pretty stunning. Anyway, this mom who works at Chipotle, to save time, would just bring home food, and they have great healthy options, but it's the serving sizes. And the whole family worked together to say, okay, we're going to all eat a healthy meal. And I went and had dinner with them, and it was wonderful to see everybody, spritzing some lime instead of loading up butter and sour cream, but not stigmatizing children and saying, we all need to do this together.
Yeah. And I think it's really going to be in communities where we tackle this. I would argue, take Mark's community. Every single person, every single business in that community has a stake. And it's going to take all that to turn it around. We're not going to get anywhere a person at a time, a child at a time, or an adult at a time. We talk about creating a culture of health. How do you do that? I think you do it with the community saying, you know what, we're going to put this into everything we do. We're going to have teach you in the grocery stores. The restaurants are going to get involved. The dry cleaner is going to put tips on the plastic bags. You look at how everybody could come together. That's our only hope of doing this, and to convince everybody it is their issue.
It's pretty sad to think of that many people being unhealthy, the unhealthiness of a whole community. When we talk about the cost, why do we say it's going to cost the state $6 billion, say, in 2025?
Well, obesity, when we're talking about diabetes today, and Dr. Hill was talking about this a moment ago, obesity affects every part of your body. Almost every disease that we know of is more common in obesity. There's a few exceptions, but diabetes, high blood pressure, heart disease, arthritis, gallbladder disease, cancer, and you can go on and on. So people who are overweight and obese develop more medical conditions. For any medical condition they have, it also costs more to treat overweight people. Any hospitalization they have, they get more complications and they stay in the hospital longer. So their hospitalizations take longer. So they get more diseases and they're more severe. And the cost of that is already very astounding, and it's going to be worse.
And that doesn't even begin to touch on other things that are not purely medical. You look at lost productivity that we have from the work I might miss, from things that I might otherwise be doing that are contributing. And so you can really see these cost estimates begin to climb. There are folks who talk about how difficult it is today even to recruit into the military because we don't have kids that can pass the fitness tests anymore to be in the military. So you begin to see that this is a national issue. It comes out of our families and our communities, but it very quickly affects our states and us as a nation. And some have actually commented that this is the Achilles heel of the United States, that this could be what brings us down. Now, I don't choose to accept that because I think we're better than that, and we're not going to let it be our Achilles heel. But I agree with everybody. It is going to take a community by community by community to do this. I'm confident we can, and we have to.
We need something big here, though. I really do believe that it could be our Achilles heel unless we turn it around. This is not going to be fixed by little stuff. You know, I've little tongue-in-cheek suggest that we need a Manhattan Project. We need, as a country, to say this is our biggest challenge to not just our health, to our quality of life, that we need a big inspirational project. There are a lot of people that want to get behind this, but it has to be something big to inspire people to do it. But if we emotionally realize that we have to solve this problem, not solving this problem is going to lead to all kinds of bad things. We need something big to move forward.
I would absolutely agree. And I think one of the things that we see is that there's a place for everybody in this. There's a place for families, there's a place for business, there's a place for healthcare, there's a place for government.
Okay, that's where I want to stop you, the place for government. The mayor of New York took a lot of criticism for this plan of his that says you can't buy a soda bigger than 16 ounces. Is that overreach from the government point of view? What do you all think?
I think it's not the role for government. Number one, people want to do something well-meaning. That sounds well-meaning. The problem is sodas are only one tiny bit of the problem here, and we're putting a lot of resources there. I actually think Mark's point, everybody's got to be involved. The private sector has to be involved. The government has a role, but I think the government could play a role by incenting the private sector to go the extra step to promote healthy options. If you want to eat healthy, it's got to be both healthy options available plus a demand for healthy options. That's the government's role. The regulation, the tax, the ban, I don't think it's going to work.
Well, I mean, I agree. I think that I'm encouraged by the fact that people in all sectors, as you just mentioned, are actually very interested in solving the problem. I mean, we talk like this is a doom and gloom situation and somebody better do something. I think people are doing something. We have a Center for Human Wellness. We have, you know, a lot of good initiatives that I think are a major step in the right direction. A lot of people that are interested in it. The First Lady of the United States is trying to get kids out moving and eating healthier. I mean, that's a tremendous, you know, leadership advance, I think. And so I'm encouraged, while discouraged at the same time with the numbers, but I am encouraged. Well-meaning people want to fix this, and they're doing things to do so.
How is that going in Los Animas? How long have they been trying to be this community against obesity?
It's been just a couple of years, so it's a new effort, and honestly, it's an uphill battle. It's really hard, and I was struck by the history of the town, that the meaning of the town is actually sort of the lost souls, and I think that in some sense we all are. We're on this battle. You can feel very lost. And they have reframed it in their town. They have these new banners that they're the city of spirit instead of lost souls. And maybe that's what we have to do, is reframe this entire debate, that we have to find the solutions, even if we're up against the fast food industry and the sodas and all that. Now, I think the soda tax idea is very interesting. I'd be curious to hear what you think about this. A lot of people think we need to view this like the tobacco situation and tax it extremely heavily and see if we can channel those funds to help beat obesity.
Let me get a short comment from each of you on that before we wrap up.
Well, I think we want to engage our communities in a way where we do talk about what the role of government is, because I think it may look different in different places because of the challenge, but I do think that there is some place that we want to see our government help us get there. Whether that's through a tax, that might work in some places and not others. But I do think if we leave them out, we wouldn't have hit the moon if we had left the government out, despite all of the creative scientists and all of the production that was going on in the private sector and in communities. And I think we want to rally around as a nation a very positive approach to move us to a goal.
Maybe a presidential fitness program again.
Right. I would like to see healthy foods cost about the same as fast foods and sodas. I think, although it's not all cost, certainly somebody might want a soda because they like the way it tastes, but nonetheless, it's true what Mark was saying a while ago, that energy-dense fast foods are less expensive, and it's more expensive to buy foods that are really good for you, and some sort of equalization so that it wouldn't at least be a financial burden to eat healthily. That is something the government could move towards.
Last comment, Dr. Hill.
Yeah, I don't think the tobacco is the good model. You don't have to smoke, but you have to eat. I think a better model is sustainability and recycling, where actually the industry helped lead the way. Do we need the food industry and the fast food industry to change? You betcha, but they aren't going away. They're still going to give us our food. Tobacco model is the villain, make them the villain. It isn't going to work here. We need them to change, but we need them to have a seat at the table.
And as you said before we started taping, you see this as a Manhattan Project type, the scope of it.
We need something big and inspirational. People are looking at this saying, there's no hope. We're all going to get obese. We got to do something big, and we got to do something that gets us where we didn't think we were going to be.
Thank you all very much. That is Colorado State of Mind for this week. You may see the program again if you go online to video.rmpbs.org. Thank you now to Katie McCrimmon and Dr. Mark Wallace, to Dr. Michael McDermott and Dr. James Hill. You can find the full iNews story this week by going to our website at rmpbs.org/reports, where there is a link. Next week, we turn our attention back to the 2012 election in a special edition of Colorado State of Mind that we are taping with Gwen Ifill from Washington Week and another group of people in Madison, Wisconsin. It's all about Colorado and Wisconsin as battleground states in the race for president. Join us again next weekend for Colorado State of Mind. I'm Cynthia Hessen. Good night.